Pregnant women being led by health workers to sing motivational songs and chant health instructions to memory. These women are beneficiaries of the free primary health care initiative of the MDGs Office and the National Health Insurance Scheme, NHIS.
No matter wherever you are coming from, even if it is not from Ibadan Southeast Local Government, as far as you are a pregnant woman and you are carrying a baby that you have just delivered from 0 to 5, you are free to register and the treatment is free.
Everything is free here. We do weighing, blood tests and the rest, and we don't pay at all.
Shakiratu Adeleke is 30 years old, pregnant with her 4th baby, which is due later this month. She is here today for her routine checkup. Then she joins other women for a singing and dancing exercise. Health workers then step in to teach the women some healthy practices.
We let them know that food is very, very important for the babies, and then we just supplement with the multivitamin drugs and get their immunization at the right time they're supposed to get their immunization.
We have been taught how to make oral dehydration therapy, which I didn't know how to make before. They also taught me how to prepare nutritious food.
Shakiratu really appreciates the free services she gets here. Now she wishes that free food and beverages could also be provided.
Now we want beverages, milk and food.
Health sector reform and the National Health Insurance Scheme are making impacts with the introduction of the Community Health Insurance Scheme in 6 pilot states with a focus on pregnant women and children under 5. The program is working and has more room for beneficiaries if only they show up.
It's really working. Honestly, it has reduced the death rate in our grassroots in Oyo State, basically. But the challenges that we're having now is just the low turnout of our people. So, this thing is free. We want them to come out so that they will benefit in these ongoing free healthcare services.
12,000 rural people in Ibadan Southeast are registered so far. The Health Maintenance Organization has been paid over 9 million naira by the MDGs Office through the NHIS since the initiative kicked off about a year ago.
This project is good because funds have been made available by the MDG Office.
Taiye Adeleye has been a pharmacist for over 30 years. He joined the civil service 10 years ago and is now the coordinator of the National Health Insurance Scheme in southwest Nigeria. He speaks on what debt relief gains have been spent on in this center.
It is a well-stocked pharmacy, particularly the kind of drugs that are required by children. The MDG MCH NHIS project is not limited to just providing drugs. It's a total package. The entire primary health care center is being upgraded. Where we have lack of beddings, part of these funds is used in provision of such beddings, like the pillowcase I displayed.
The National Health Insurance Scheme has been referred to as the fastest growing social health insurance initiative in the world. Managing the scheme is Dr. Mohammed Bello Waziri Dogo Mohammed, a medical doctor with over 30 years of experience and training in Nigeria and abroad.
We are a regulator of the prepayment for health in the country, and we are trying now to sort of metamorphose to even a bigger regulator where it's not only the social health insurance we are looking at, but various prepayment arrangements for health in the country, whether they are 100% paid by the government or developmental partners, or they are in the private sector. The NHI initiative is about giving protection, for health to people, so that finances shouldn't be a barrier to accessing care. Everybody should be guaranteed quality and affordable care in the country. And we started with federal government employees. And as I'm talking today, over 95% of federal government employees and their families are covered under this. And end user satisfaction surveys have shown to us that over 85% of those who have enjoyed the program are satisfied with it. So for us, that is a good indication that it is working.
Dogo Mohammed, however, has a great worry. The scheme he manages currently enjoys funding from the MDGs Office, but he believes that it might not last forever.
The MDG funds are not forever. They are here, we're looking at 2015. So the debt relief gains, for how long are they with us? We have to have a homegrown way of financing this, because there is no point we start it and then midway we are making progress, or we have even attained the MDG goals by the target date or even before, and then there is nothing to continue, financing this. And somebody has to pay.
Over 5 million Nigerians currently benefit from the health insurance scheme, with no contribution for the last 4 years. Billions of naira has also exchanged hands in that time.
There was a moratorium of 2 years. So federal government was paying its 10% as an employer of labor. The amount of money we are getting from the federal government contribution runs into billions, almost 70 billion or so over the last 4 years. And we have been able to spend almost 50 billion to send to the hospitals through the health maintenance organizations, to also have money for reserve, because you must have reserve just in case of eventuality.
The MDG's office is helping various governmental establishments for the continuous capability improvement of health institutions, including hiring and training of health personnel. Nigerians, both young and old, are also being provided with knowledge to help combat diseases and achieve the Millennium Development Goals on health.